Hello everyone. This presentation is on Mai Men Dong Tang, also called Ophiopagoni's decoction. It appears on the California Acupuncture Board Examination Herbal Formula list. I will review its traditional pattern, a short hypothetical patient case, 3 potential drug-herb interactions, and a practical management plan. The purpose is educational. Herbal formulas are selected by pattern, but medication safety still requires attention to pharmacology, dose, duration, and the individual patient. Traditionally, Mai Men Dong Tang is classified under treat dryness. A representative pattern is lung and stomach yin deficiency with rebellious chi, dry cough, and dry throat. Important ingredients include Mai Men Dong, Ban Zia, Ren Shen, Gan Kao, Jing Mai, Da Zhao. The key clinical idea is pattern matching. A formula can be appropriate for one patient and inappropriate for another patient with the same biomedical diagnosis. Before treatment, I would also screen for red flags, confirm that urgent biomedical evaluation is not being delayed, and review the exact medication and supplement list. My hypothetical patient is 64-year-old woman with chronic dry cough, diabetes and hypertension. The current medicines are metformin, lisinopril, hydrochlorothiazide. This case gives a plausible reason to consider Mai Men Dong Tang, but it also creates interaction questions. I would document the tongue and pulse findings that support the pattern, confirm the diagnosis, and ask about allergies, pregnancy status when relevant, kidney and liver disease, bleeding history, and use of over-the-counter products. Medication reconciliation is essential because many interaction risks come from the combined physiologic effect rather than from one single herb. Interaction 1 is Gan Kao plus hydrochlorothiazide. The mechanism is licorice can increase sodium retention and potassium loss. The clinical significance is moderate in hypertension or with longer treatment. My management plan is monitor blood pressure and potassium. I would explain to the patient that evidence quality differs across herbal products and interactions. Therefore, the safest approach is to use a known product, avoid unnecessary overlapping supplements, and pay special attention to medicines with a narrow therapeutic index. Interaction 2 is Ren Shen plus metformin. The mechanism is ginseng may further lower glucose. The clinical significance is moderate if appetite is poor or other glucose-lowering drugs are added. My management plan is monitor glucose and symptoms of hypoglycemia. I would explain to the patient that evidence quality differs across herbal products and interactions. Therefore, the safest approach is to use a known product, avoid unnecessary overlapping supplements, and pay special attention to medicines with a narrow therapeutic index. Interaction 3 is lisinopril-related cough confounding. The mechanism is an ACE inhibitor can itself cause a persistent dry cough, which may be mistaken for an herbal pattern alone. The clinical significance is high diagnostic importance even though this is not a pharmacokinetic interaction. My management plan is ask the prescriber to assess medication-induced cough before simply escalating herbs. I would explain to the patient that evidence quality differs across herbal products and interactions. Therefore, the safest approach is to use a known product, avoid unnecessary overlapping supplements, and pay special attention to medicines with a narrow therapeutic index. In conclusion, Mai Men Dong Tang may be reasonable when the patient's presentation matches lung and stomach yin deficiency with rebellious chi, dry cough, and dry throat. The main safety principle is not simply to label herbs as safe or unsafe. Risk depends on the specific herb, preparation, dose, treatment duration, the patient's organ function, and the drugs being taken. I would use a reputable product, start conservatively, monitor the most relevant objective values, and communicate with the patient's physician and pharmacist. This presentation is for education and does not replace individualized medical care. Key references include the California Acupuncture Board Examination Formula List, standard Chinese herbal formula texts, such as Bensky and colleagues, Chen and Chen's Pharmacology and Applications text, and evidence-based drug and herb interaction resources. Thank you.